Hi, I'm Dr. Emily Bennett, naturopathic doctor. Welcome to my YouTube channel. One of my expertise is in treating polycystic ovarian syndrome, or PCOS. And one of the reasons I became an expert in PCOS is because I received my own diagnosis of PCOS in 2009, and it was really the thing that led me to discover naturopathic medicine and then kind of change my path to become a naturopathic doctor. So I've thought a lot about what it's like to receive a diagnosis of PCOS. I see so many people with it in my private practice, and I talk to a lot of folks online about PCOS too. I feel like people on the front line of diagnosing polycystic ovarian syndrome, family doctors, even some gynecologists, don't have a very clear way of talking to folks with it. Maybe don't even have that deep of an understanding of what it really is. When we're talking about a syndrome, we're talking about a collection of symptoms. And so you can really present with any number of those symptoms in a group and end up with a diagnosis. There are criteria, of course, laid out for diagnosing PCOS, various ones, and it's usually some combination of not getting your period or not ovulating or having irregular menstruation, along with markers on your blood work that indicate there are hormone irregularities that are consistent with PCOS, physical symptoms of what is called hyperandrogenism. So these are symptoms of PCOS like acne, mostly along the jawline, hair growth on your face, around the nipples, under the belly button, hair loss on the head, and then finally potentially the addition of a pelvic ultrasound that actually reveals polycystic ovaries. So you can have 3 out of 4 of those criteria, and then you get the diagnosis of PCOS. But even within those criteria, there's a lot of room for interpretation. A lot of the time, blood work, for example, not the right blood tests will be done in order to correctly see whether there are changes to your hormone levels that are consistent with PCOS findings. And even the research itself, there's not a lot of standardization from case to case about what your blood work's going to look like if you have PCOS. There's a lot of variations. There's a lot of different ways that you can present and still have polycystic ovarian syndrome. Why does this matter? Well, when we're talking about sort of natural, or rather, lifestyle, maybe nutritional, maybe supplemental ways to support a diagnosis of PCOS in order to stop the progression to some of those scary outcomes you've probably read about online. We're talking about diabetes, we're talking about heart disease, infertility, and other issues that are associated with long-term uncontrolled symptoms of PCOS, then we want to kind of consider beginning some degree of treatment, even if you're sort of like way here on the low side of the spectrum of how many symptoms you're presenting with. So basically, what I want to say is, if somebody has suggested to you that potentially what is going on is PCOS, then I encourage you to dig a little deeper into what has been found. Reach out to experts online if you can't find them in your community to understand better what's showing up in your blood work, because there's a real potential that the person you're working with does not have a clear idea of what's going on with the whole varied ways that PCOS can present. And if we catch things earlier on, even if you're, again, not over here, presenting with all the things you're reading about, trouble with blood sugar, acne, hair loss, hair growth, not getting your period, these are sometimes people present with the kind of utmost symptoms of PCOS at the far end of the spectrum. But maybe you're way down here and you're presenting with some of them, doesn't seem particularly urgent. The effect on your current quality of life is not totally evident, but maybe reading a little bit about PCOS is explaining to you some of the things you're experiencing. Trouble with anxiety, trouble with falling asleep, not feeling well after eating certain meals. All of these sort of vague symptoms can indicate, trouble with insulin sensitivity, trouble with hormonal control at the level of the adrenal glands, which can all be a part of PCOS. So even if the person that you're working with thinks probably not PCOS, even though it looks like it a little bit, reach out for a second opinion. Become your own best advocate by digging into the research a little bit better and reaching out to other experts. because engaging in these basic things, lifestyle stuff, nutritional changes, that can prevent things from progressing further to the point where maybe you do need one of these medications that are commonly prescribed for PCOS. Things like metformin, spironolactone, birth control, etc. PCOS, receiving a diagnosis of PCOS is not a life sentence. There is so much you can do to engage with your symptoms and have an effect on them. And I know for me, receiving a PCOS diagnosis changed my life for the better in so many ways. It made me connect to my body, to pay attention to how I was feeling in such a deepened way that in a lot of ways it changed my course, my life course entirely. So don't despair if you've got a recent diagnosis of polycystic ovarian syndrome. It does not mean that you are not going to be able to have babies. It does not mean that you're going to get diabetes. It does mean that you have a susceptibility to these things. So start paying attention, start asking for help and looking for experts if you feel like the people you're working with locally, maybe your family doctor, your obstetrician, gynecologist, even your naturopath or nutritionist, if you feel like they don't have a clear idea of what polycystic ovarian syndrome is all about, explore. This is one of those things where crowdsourcing from the community of people online who are dealing with PCOS and talking about it can be so helpful. That's all for now. If you have any questions or ideas for topics for videos, please leave a comment down below. And if you'd like to check out some of the free downloads I have around helping to understand better what's going on with your PCOS, just click through on the description. Thanks for watching.